One of the things that people get wrong about therapy is believing that therapy is going to solve all of their problems without them having to make any effort to the process. But not only that, they also believe that once they've completed the number of sessions, whether it's 20 sessions, 50 sessions, or 100, then they are never going to experience any challenges, they're never going to face any difficulties in future. Well, if that is your expectation about therapy, then you probably need to be very specific about the kind of therapist that you're looking for, because you need one that has a magic wand. One of the functions of therapy is to help the individual become aware of themselves, become aware of the situation they're in. So if they're presenting with a specific problem, then the therapy process is going to help the person understand how they fit into that problem. And not only that, but how they got into that problem. What kind of choices did they make? What kind of weaknesses did they have that led them there? What kind of weaknesses did they have that other people saw that took opportunity on to propel them to that situation they're in? And then after that, therapy is going to help the individual now create different pathways that they can use to come out of that situation. But it is up to the individual to choose the pathway they want to take, to decide on the pathway. So therapy is about enhancing a person's autonomy. It's about empowering the individual with all the information they need, with all the awareness they need about the conscious drives and unconscious drives, to be able to make decisions that are well informed, decisions that have good outcome, or at least can be expected to have good outcome. That's one of the functions of therapy. And so the process takes long, and there are no guarantees because variables are not constant, and sometimes you're not aware of all the variables. And that's why when you're going to therapy, do not also expect a guarantee that all of your problems are going to be resolved, or all of your problems are going to be known or addressed. So therapy is the way we treat perhaps different illnesses. You can be given an antibiotic for a specific illness, and usually works for a lot of people, but then it might not work for you. Or you might be given a medication to treat a certain illness, and many people use it, they don't get side effects, but you use it and you get side effects. Look at therapy in that perspective, and it will help you understand what kind of expectations you want to have when you're going into therapy.